to prepare the slide for doing the morphology of this sperm?
So there are two ways to prepare the morphology slide. See, we get such type of stains. So now this is a, see here again I am saying that I am showing you some stains, by no means I am telling you to, it is a stain you can buy from any company, but it's the one which we use. So it is called stain A and stain B, 25 ml bottles. They all come in different preparations. So you can put 1 drop of this, 1 drop of this on semen sample, mix it, and as you prepare malaria slide, Mahiti, prepare malaria slide, आगे जाके पीछे जाके आगे आते, prepare a malaria slide, and then this got a fixative. You can spray the fixative, more of an alcohol. Spray and slide is fixed. Alcohol. Cry baby हमारी. So slide is fixed. Done. The second method is we use something. So ma'am, can you please pack it up on this? You will take the pictures later, and I'll be sending you the literature of all these things as I keep posting to you. I'll be, and yesterday I've given you a lot of literature in case you have checked your things. Yes. So do read it. This is a pre-stained slide. Here you put 1 drop of semen sample and then come back, and then it's called a butterfly stain. Come back and go ahead. So it's a pre-stained. Everything is there already. Stains are here. Okay. It's called quick. It's called quick check. Pre-stained. It's from a company called MES. This is from a company called Crisco, and this comes from another company. They come individually, and it's again a pre-stained slide like this. Put 1 drop on this, and they will take all the stain.
We need not use fixative for this.
No, you may or may not. You may or may not.
Okay. But just a drop of semen.
Drop of semen sample. That's all. But I am not very fond of these slides. I like to prepare the smear myself. This why do we fix? Because we are looking at 100x objective. So this is the way we do the morphology. Then I've been telling you guys to use. Do we have 1 drop of semen sample lying on that somewhere in one syringe? देख लेते मेरे को दिखाया अगर है तो. So what?
है तो वही syringe पर.
Let's try. Give me बेटा मेरे को give. So we were talking in the morning that how do we निकाल दीजिए मेरे को. How do we work on this? We can, in case I can put 1 little drop on this. No, I can't. We'll take a fresh one. So this is the way by which we can always look at the pH and the leukocyte content. So that's the way the color coding is given here. So what we do now, we'll show you, we have got color coding of leukocytes and color coding of the pH. And when do we do the pH?
When the volume is low and there is small
and there is
low sperm count.
And low or azoosperm.
Yeah.
Good. The one thing you guys can take, have a look at this. The third thing, so morphology is done. Now we come to the fructose test. Now fructose it is available in a 2 ml vials. We add it to the semen sample.
Okay.
And then we heat it.
Full, sir?
Yeah. Then we heat it. I'll be sending you the whole literature so that you can read it. But this is the way it comes. It comes in a 2 ml vial or a 10 ml vial. इसको sample पे डाल के sample को heat करते हैं. When the sample changes color, it's a color coding given here. We know that fructose is absent or present. Put it up. It's called a fructose. It is called fructose testing, but that is a qualitative, present or absent. It is not quantitative. That's what we need. Low volume semen sample. We just put in this and we heat it we take a glass tube and just heat it over the gas. In case it turns orange, the color changes, then we know fructose is. You must be remembering we used to do this fructose in the urine.
Selvinox test.
करते थे. नहीं वो हमें ये तो चेक करते थे ना शुगर कितना आ रहा है. Boiling करके देखते वो protein coagulation test वो. Same day it changes color. This is a horse test. In the horse test, again available at like this. We we add semen sample to it. I'll again send you the protocol, you can read it. But that's the way it is available. You can buy it from the market. They are 1 ml vials available. One per patient we use. We add semen sample to it and we see it within 3 to 4 minutes. Semen sample is around 100 microliter.
1 ml.
No, इसमें equal volume जो है. इसमें जितना भी sample उसमें डाल देते हैं इसको.
Is 1 ml of semen
1
sample?
ml of. So it is 1 ml kit. We put the semen sample and wait for 3 to 4 minutes. In 3 to 4 minutes, it will curl the tail. In case you want to do a procedure, then 3 to 4 minutes is good enough for you, or 5 minutes. It's only for diagnostics, you can do it for longer time.
So
Because
we have to put it on one slide because 1 ml is more for a slide.
I'll tell you the protocol. I'll send you the protocol. Abhi, what you should do is that there are two ways to do it. One is diagnostic, other is therapeutic. Therapeutic means that we want to utilize the test for doing a procedure. And it's not for IUI, it's always for ICSI. So 4 minutes के अंदर, 5 minutes के अंदर जो tail curl हो गया उसको उठा के कर लेना. And when you talk about diagnosis, that you can do after half an hour also.
Okay.
We count the number of sperms which have got
Curled.
curled tails. And what should be the number of curled tails? What is vitality? When do we carry out vitality staining?
If the number of sperms, motile sperm is less than 20% of the
When the large number of sperms, they have not defined the numbers as per WHO manual. When we have large number of sperms are
which are
having
immotile.
immotile, then we carry out this particular testing.
Testing.
One more kit which is there is called eosin testing. That also comes in a small 1 ml bottle. You take, like a dropper. You take drop of a semen sample, like in this slide. Take a slide, put a semen drop, put eosin, and then just make a smear.
And we have to
In case you put eosin nigrosin, we make a smear, dry smear, or we can do wet smear. In wet smear, we'll add one drop each, mix it and see under the microscope. All the pink sperms are good or bad?
bad.
Bad. Pink sperms are bad. And when we use HOS, in case the tail curls, it is good or bad? Good. So, and then इसके अंदर we can check the leukocytes and pH, and but we don't do it for every patient. Morphology for all.
Yes.
So you can use any method, morphology for all. HOS is a vitality stain when the viable number of sperms are less, and fructose we do when we have a low volume semen sample and acidic pH. This is easy to check. So don't go to check fructose directly. Volume and pH, then go to fructose.
Okay.
Don't check for fructose is a test which takes some time. So yes, I think that's
So
it.
this we put 1 drop of this on slide, 1 drop of this and 1 drop of semen and we mix it over there.
Mix it over there.
Then prepare the stain.
Then you spray,
Then
fix it.
Fix it
it,
all
fix it,
cover. And directly see you in the microscope.
So for that HOS, I feel that you have to